So someone should come here if they're looking for what I call the total body experience. Took this turn in my career a couple of years ago when I was trying to go down a path for my own health. It started with brain health, and having lost my father to dementia and Alzheimer's, I wanted to look personally at what can I do to reduce the chances of me going down that road. What can I do to be healthier? And very quickly, I learned about the brain and your gut and the brain-gut axis and inflammation and all of the things that happen. And if you're talking about gut health, you can't talk about gut health without starting in the mouth, which is exactly where all this starts. I really took a deep dive into what are the systemic connections, what are the things that we can do inside the mouth to make the mouth healthier so that everything downstream can be healthier as well. So I spent a lot of time in my training on the biological dentistry side of things and looking at different materials and different techniques and different things. Probably the most important thing that I learned is the things to do pre-operatively and post-operatively that are different than what I was previously doing. And what I mean by that is utilizing some health and longevity tools and techniques that we have, some biohacking things that we have. I like my patients to be on supplementation for 2 to 4 weeks leading up to the surgery, and then for at least 4 to 6 weeks post-operatively. Prior to all of this, we are measuring different levels. We're measuring different vitamin levels. We're measuring different hormone levels. We're doing body composition. We do a metabolic breath analysis so that we can help people find a healthier path as they move forward. We do saliva testing where we're looking at, in this particular test that we're doing, we're looking at 11 different microbes that are very important in determining how susceptible someone is to potential gingival problems and periodontal disease and decay and those types of things, as well as a genetic component. Everything that we do here, I want to be able to track it. I want to be able to say, this is where we started, this is what happened through treatment, and this is where we've ended up. And to be able to show those results and to be able to utilize a lot of the things that our own bodies do to help heal ourselves means the world to me, because we're doing things with far less medications, especially post-operatively. Utilization of the patient's own blood concentrates through platelet-rich fibrin and how we incorporate that into so many of our procedures, that leads to a dramatically reduced incidence of infection and much less inflammation, which is less swelling, less post-operative discomfort. And the things that we do to get the body ready for that with supplementation and, for example, hyperbaric oxygen therapy before and after the surgery, we're just seeing some incredible healing, and we're seeing some amazing post-operative results are not common to what I used to see prior to these protocols. The supplementation alone that we utilize is specifically developed for bone and soft tissue healing. That also goes very well with hyperbaric oxygen therapy. So when we incorporate all of these things, not only on the surgical side, but when you get to the restorative side, when we're actually putting the crowns on the implants or crowns on natural teeth or whatever the plan is, the efficiency with which we can deliver the final product with our digital workflows, and instead of taking traditional impressions and all the stuff in your mouth, we use digital scans, and we're utilizing different types of files that are going to the equipment here in the office where we can create the final prosthesis and the final crowns or the dentures or whatever the final prosthesis is. We do it right here in the office. So it's kind of a one-stop shop for a lot of those things, and it makes it very efficient for the patient as far as the amount of things that we are capable of doing here in the office in one visit.